I'd now like to invite Minister for Health, Minister for Medical Research, the Honourable Gillian Skinner, to provide us with her vision for healthcare services in the state of New South Wales. Please welcome up the Honourable Gillian Skinner.
Thank you. Thank you very much indeed, and may I acknowledge my colleague Mel Gibbons, who's just arrived. Thank you for coming. May I start as well with acknowledgement of the traditional custodians of the land on which we meet, and pay my respect to elders past and present, and thank you, Michael, for your very warm welcome. To my parliamentary colleagues, Kevin Humphries, to the local members, to board members, acting Chair Peter Gonski, Janet McDonald and others who are here, to the Director General, to Terry Clout, the Chief Executive, and to all of the health workers who are in the room, but other community members who are showing great interest in what we're doing. And also to Ray Crean, thank you. I've said I always fall for a man in uniform. Thank you very much for coming, guys. And the cops, thank you for coming too. Look, it's true, I set out on a vision when I became the Minister of giving much greater responsibility to local people about how our health services are being delivered. We said we'd be far more open and transparent about what was happening, and we have. We are providing a record budget this year, for example, $17.9 billion in recurrent funding, which is a 5.2% increase on last year's budget, $884 million extra dollars, which are being delivered to the local health districts, which under service agreements provide for the extra patients that are coming through with increased demand. So that money, for example, will purchase 69,000 extra emergency department attendances, 34,000 extra overnight inpatient bed days, and 3,000 extra operations. But it also provides money to carry on with those programs that have been no longer funded by the Commonwealth Government this year. Funding that ended this year, $100 million, programs such as rehabilitation, some of the subacute services and other services. The other thing that I'm very proud of is the money we've put in our budget to attract innovation and to assist the local health districts in coming up with new models of care that particularly focus on providing out-of-hospital care for those patients for whom that is in the best interest. And today, during the day, I had a great deal of pleasure visiting Sutherland Hospital this morning with Professor Gonski, looking at their marvellous geriatric services there, talking to the team about how they provide care for geriatric patients, meaning they don't have to come into hospital. They can be treated in situ in aged care residential facilities, but also out in the community. It is a marvellous program that is best for the patients, but also frees up the emergency departments and also those acute hospital beds so that other patients can be treated. I also saw during the day the work that's being done at St George Hospital, some of which you'll see later at their mental health facility being built there, but also the emergency department. One of the as well as the recurrent funding in this year's budget, we're providing over $1 billion out of our total nearly $5 billion investment in health infrastructure over the first 4 years, hope it's the first, of the O'Farrell government, to catch up on the capital funding that's needed to build our hospitals. And it was thrilling to stand on the top of the car park, look down on the side of the new $39 million emergency department that is being built there, with 72 treatment spaces. I believe that it's the largest, it will be the largest in the state, if not, then very close to it. And that really is what the staff deserve. They deserve facilities that are fit for purpose and that will be able to treat patients better. In terms of staff, I'm very proud of the fact that since I've been the Minister, just over 2 years, we've employed an extra 4,000 nurses. That's a head count. When you take it equivalent full-time, that's around about 2,800. And on top of that, you include those that are employed in the third schedule hospitals, which are, of course, also providing public service. So we promised at the election to employ an extra 2,475 nurses. We're over that halfway through our term. And I think that's entirely appropriate, because as even the staunchest doctor will tell me they can't do their work without the nursing workforce. I'm the daughter of a nurse, so you'll forgive me for saying I understand how important that is. Look, one of the other commitments we made at the election was to hold public forums. This is the third we've held. We did the first in the country in Dubbo. Last year we did one in Parramatta, and this is the third, and I'm delighted that it's here in southern Sydney with my parliamentary colleagues who are so supportive in everything that we're doing, and the local health district board and chief executive, which I believe is showing the way in many respects. There is much more I could be talking about, but I'll leave it at that, and look forward to answering your questions during the forum. Thank you very much.